Some men let time pass. Desire fades, sexual activity disappears, and the body begins to react. An inactive penis becomes a warning sign. Behind the silence, the prostate starts to suffer, and the risk increases even when there are no visible symptoms. Without stimulation, the natural functioning of the intimate region changes. Blood flow decreases, inflammatory substances build up, and prostate health becomes unstable. This has a direct impact on daily comfort, vitality, and, in many cases, opens the door to more serious issues over time. I'm Dr. SARA RICCI, a urologist with over 15 years of experience, and in this video, I'll show you why a lack of sexual activity can have devastating effects on your prostate, and most importantly, what you can do to reverse this scenario with simple, natural, and accessible actions, regardless of your age. Before we continue, check if you're already subscribed to the channel. Here you'll find essential content about men's health, with a special focus on the care that becomes even more important after 50. If this topic has already made you reflect on something you've been overlooking, hit the like button. This helps this information reach more men who also need to take better care of themselves. And feel free to comment, type 1 if you like the topic, or 0 if you'd like to suggest a subject for future videos. Your participation is very welcome. When the prostate goes too long without stimulation, it starts to accumulate substance that should be expelled more regularly. It's like leaving water sitting in a bucket for weeks. What was once clean starts to spoil. The same logic applies to the prostate. Without what's known as ejaculatory activity, the internal environment becomes more prone to inflammation, and that's one of the first steps toward pain, urinary discomfort, and that annoying heaviness in the pelvic region. This is not an exaggeration. The prostate was made to produce and release part of the semen. When this process doesn't happen regularly, everything inside becomes congested. One of the most common signs of this is an increased urge to urinate at night, or the sensation that the bladder isn't fully emptying. A patient once told me, "Doctor, I thought going without sex wouldn't do any harm, but my body started to complain." And that's exactly it. It's not about pressure or exaggeration to maintain an active sex life at all costs. It's about understanding that internal function depends on movement, and when that stops, problems begin, often in silence. Among many studies on male health, one stood out for the clarity of its results. It was conducted by researchers at Harvard University and followed thousands of men for years. What they found was simple, but very important. Men who ejaculate frequently have a lower risk of developing prostate cancer. Specifically, men who averaged at least 21 ejaculations per month had a 31% lower risk of facing this type of cancer. This isn't about excess. It's about physiological balance. The explanation lies in the effect of ejaculation itself. When it occurs, the body eliminates inflammatory waste and stimulates blood flow in the pelvic area, which helps oxygenate the tissues. These two factors together help keep the prostate environment cleaner and healthier. It's as if the body gets the chance to renew that system more often. If you want to take a step further in caring for your intimate health and keep your prostate active and protected, I recommend reading my digital book, Rediscovering Intimacy: Healthy Sexuality After 60. In it, you'll find practical guidance to maintain sexual function, strengthen your relationship, and adopt habits that preserve your body's vitality over time. You can access it in the first pinned comment. Many older men believe they don't need to worry about this anymore, but that's exactly where the risk lies. The idea that sexual activity is just a luxury or something unnecessary after a certain age needs to be reconsidered. Science has shown that maintaining this habit, even moderately, is an essential part of preventive health. Masturbation still carries a lot of taboos, especially among older men. But when we look at health objectively, without prejudice, a clear truth emerges. This simple, intimate, and accessible practice can be a powerful ally for prostate health. And this isn't just opinion, it's something science has already confirmed. When a man masturbates regularly, he stimulates a blood circulation in the pelvic region and helps release substances that, if accumulated, increase the risk of inflammation. It's like opening a pressure valve. The body is grateful for this natural relief that doesn't require medication, prescriptions, or a partner. For those who are single, widowed, or going through relationship difficulties, masturbation becomes a practical way to maintain the ejaculatory regularity recommended by experts. It also promotes self-awareness, improves control over arousal, and can even help reduce anxiety. An older man once told me he felt ashamed just thinking about the topic, but after learning about the benefits, he started approaching it more naturally, and that makes all the difference. Caring for your prostate also involves the way a man relates to his own body, with respect, without guilt, and with awareness. Many people see sex only as a source of pleasure or something associated with youth, but the human body doesn't work that way. Sexual activity has a deep impact on hormone regulation, the nervous system, and even heart function. When a man maintains an active sex life, even if less frequent than in his younger years, he triggers the release of hormones like dopamine, oxytocin, and endorphins. These complicated names refer to natural substances that relieve stress, boost mood, and increase the sense of well-being. In addition, sex activates blood circulation, especially in areas that tend to lose vitality with age. This not only supports erectile function, but also helps keep the prostate in good condition. Intimate contact also strengthens emotional bonds in a relationship, improves self-esteem, and reduces symptoms of anxiety and insomnia. A patient once told me that after a long period without sex, he felt more irritable, slept poorly, and lost interest in things. When he resumed his intimate life with his wife, little by little, everything started falling back into place. His body responded, and so did his mind. That balance between the physical and the emotional is one of the keys to aging with quality. Over time, many men begin to notice that their erections aren't as firm as they used to be. What few realize is that this change isn't always about age itself. Often, it's about lack of stimulation. The penis, like any other part of the body, needs active circulation to function properly. When sexual activity isn't regular, the blood vessels that supply the area can lose efficiency, and that directly affects the quality of erections. It's like a muscle that hasn't been used for too long. It doesn't disappear, but it weakens. And this weakening doesn't happen overnight. It builds slowly until the man realizes he needs more time, more stimulation, and sometimes even that isn't enough to maintain a firm erection. One elderly man told me that after years without sex, he felt like his body had forgotten how to react. And that makes perfect sense. The human body works through repetition. When something is no longer frequent, the brain stops prioritizing it and sends fewer signals to the intimate region. That's why maintaining a certain level of regularity, whether through sex or masturbation, helps preserve the erectile response and keep sensitivity active. What you put on your plate and how much you move directly impacts prostate health. One of the biggest villains is excess abdominal fat, which not only restricts circulation, but also promotes chronic inflammation throughout the body. And that kind of silent inflammation also affects the prostate, increasing the risk of swelling, urinary discomfort, and even more serious complications over time. On the other hand, adding certain foods to your daily diet can help protect this vital organ. Berries, dark leafy greens, olive oil, nuts, and omega-3 rich fish have anti-inflammatory and antioxidant properties that help preserve prostate tissue. Lycopene, found in cooked tomatoes, is also closely linked to reducing prostate health risks. Regular physical activity, even light walks, makes a real difference. It improves circulation, helps manage weight, and regulates hormones essential for sexual function. A sedentary lifestyle combined with ultra-processed foods, excessive alcohol, and smoking overloads the body and accelerates the appearance of problems. The body reacts according to the care it receives, including the prostate. One of the biggest mistakes many men make is ignoring the small signs their body sends. When the prostate starts becoming overworked, it gives warnings, but in subtle ways. Waking up several times at night to urinate, noticing a weaker stream, or feeling like your bladder isn't fully emptying are common symptoms, but many men dismiss them. The problem is, when these signs are frequent, they signal that something inside isn't working the way it should. As the years go by, it's natural for the prostate to grow a little. The issue arises when that growth begins to press on the urethra and interfere with urine flow. That can lead to discomfort, urinary retention, and even infections. And when a man doesn't maintain healthy habits, like proper nutrition, regular sexual activity, and stress control, the risk of complications only increases. I had a patient who only sought help when he couldn't sleep properly anymore because of the constant urge to urinate. If he had paid attention to the signs from the beginning, he could have avoided a lot of suffering. The body gives warnings. It's up to each person to listen and act before the problem turns into something more serious. Throughout this video, you've seen how the lack of sexual activity can harm prostate health, disrupt circulation, increase the risk of inflammation, and, over time, cause discomforts that could be avoided with simple, consistent actions. We also explored how regular masturbation, good nutrition, and continuous stimulation of the intimate area are valuable allies in preserving vitality, especially after age 50. Now tell me, had you ever heard about the link between frequent ejaculation and a reduced risk of prostate cancer? If this information helped you in any way, hit the like button. Your like is important because it shows YouTube this is relevant content, and it helps spread this message to more men who also need to take care of their health. And if you want to keep learning how to maintain your strength, hormonal balance, and intimate health as the years go by, check out the other videos on this channel. You'll find plenty of practical, straightforward content, always backed by science. If you're not yet subscribed, take a moment and do that now. Thank you for watching, and I'll see you in the next video.